inviting me to give this presentation. A couple of you may have heard this before. I gave this at a stem cell symposium at the University of Sydney recently. So this is actually work that was performed not here in Sydney, but when I was in Singapore by my PhD student and a group of collaborators from different faculties who I'll show later. As we've covered already, cell labeling, stem cell therapy has many different applications, but specifically for imaging, most of the cell labeling approaches have used various forms of fluorescent marker, exogenous probes, or genetic labels. But for deep tissues, once you are interested in something that you cannot penetrate with simple visible light, then you're really, or even near infrared light, you're really committed to using MRI. And here there are a variety of different therapies which have been successfully looked at with MRI in various animal models. Virtually none of this has been done in humans, I might add. So these are all lists of some of the entities that have been, where magnetic cell labeling for MRI has been used on the left, and on the right, we have a variety of laser pointers here. On the right here, you can also use this for diagnosing if you can specifically label the particle to target a certain cell, much in the same way that can be used for magnetic cell sorting. And we can also use bare nanoparticles for detection of disease progression in situations where there is natural macrophage uptake in activated macrophages at sites of disease. Now, what we do know is that clinically approved Theradex, which is now the only manufactured clinically approved iron nanoparticle available worldwide, Cinerem, which was used widely in Europe but was recently axed, Reservis, which was widely used all around the world but was again recently discontinued by the manufacturer, and in the lab, Bangs particles, which are polystyrene magnetic beads, which have a combination of different sizes and different fluorescent labels, can all be used successfully for cellular labeling, whether they be stem cells or not. And although mostly most of the work has been done with stem cells of various types, from embryonic right through to adult stem cells, there are many other cell types which are not stem cells, or maybe they're related to stem cells, which have been successfully labeled with iron and tracked in vivo with MRI. What is interesting is that regardless of the cell type, regardless of which of these labels we use, at least the superficial assessment of cell viability, cell differentiation capability, and so on appears to be good. The cells are viable, they're preserved, they replicate, and there does not appear to be any significant cellular toxicity, which is perhaps a little bit of a surprise. There are various methods that can be used to label, and we know that cells are certainly visible for days, probably for weeks, and in a few experiments have been reported to be visible for as long as a year. Iron label is generally detectable at the picogram level, so we are not at the same sensitivity as optical microscopy, for example, or radioisotope labeling, where you can potentially detect one order or two orders of magnitude further down the scale. There are many things we don't know, of course. We don't know what the labeling effects are on genomic and proteomic function, so we can look at the phenotypic expression of the cells, and that appears to be okay, but at the fundamental biological, intracellular, mechanical level, we don't really know what's going on. We do not know whether this has any effect on immunogenicity, tumorigenicity, and so on. And obviously, in the longer term, we have no long-term knowledge of cellular and tissue toxicities. However, at least in vitro, there doesn't appear to be any significant toxicity that we can detect. There are many different particles, there are many different cell types, and it turns out that you can't use one recipe for all particles and all cells. You have to optimize the labeling according to the cell, according to the particle that you're using. And there are many different methods of incubation. You can use adjuvants such as protamine, and there are various poration methods, including electroporation, and most recently this month published a new technique called magnetosonoporation, where it's using a combination of magnetic field and ultrasound insolation to make the cells temporarily porous to these materials. And so, these have various levels of efficiency. Incubation is most commonly used, but is probably the least efficient of all of the methods. But it is arguably the most natural, if you like, of all the methods. Rejection mechanisms are obviously not understood at this point, and the ultimate label in stem cell fate is a big question, especially in the situation when you have xenografts or allogeneic transplants. So MRI has been used for iron oxide labeling and imaging for some years. In fact, the particles, Feridex, was first developed in the late 1980s. And this was originally developed for clinical liver imaging, which is why there were 3 or 4 particles that were actually clinically used, and Feridex is still used for this application. However, since 1993, there have been no new clinical agents, and there have been various reasons for this. Firstly, technology has changed. MRI has become much more effective at detecting liver cancer without the use of this kind of contrast agent. In the past, in the early days of MR, we could not image quickly, we could not obtain dynamic enhancement information, and we really needed this kind of particle to give us the sensitivity to match CT scan. And recently, recognizing this, both Schering and Bay have recently just discontinued manufacturing their clinically approved particle because no one was buying it. At least no one was buying it for patients. Lots of people were buying it for cell labeling applications, but it's a really, really small quantity, not sufficient to justify their commercial continuation of these particles. And Feridex, the manufacturer of Feridex, is also questioning whether they should continue doing it, because really the only people buying it are people like me who want to label cells. There's a practical problem with MRI in that dark agents are generally hard to see. Unless you have a fairly homogeneous gray or bright background, it's difficult to perceive a dark agent. You get dilution with cell replication. You get non-specific reticular endothelial uptake and sequestration, particularly if you give these particles intravenously. They end up in the spleen, in the liver, and bone marrow. And there are non-specific labeling issues, even if you successfully label stem cells and inject them. So the particles may end up ingested by macrophages or else in the reticular endothelial system elsewhere. And they may or may not be intracellular. So even though we can see the particles on MR, they may or may not be in the cells that we are interested in. This reflects a scale problem, because MR, the highest resolution you can see on MRI typically is around 100 to 200 microns, whereas of course the cells we label are the order of 5 to 10 microns. So there's a 10-fold to 100-fold difference in the scale of our resolution, spatial resolution. The particle I'm going to talk to you about is a microgel iron oxide particle that was originally developed in Nanyang Technological University for protein sorting applications. And the main reason we were interested in this particle was because we could synthesize it to different sizes. And it turns out that all the particles that have been used in the literature so far are 1 and 1 size only. And they're either very small, medium, or kind of moderately large. And a few of them, the Banks particles, are very large. They're of the order of 1 micron in size. But nobody had explored what the effects of labeling at different cell sizes were, and whether there was an optimal size for cell labeling. So we decided that we could use this particle to do that. Basically, there are many 4 to 5 nanometer single iron oxide crystallite monocrystals within a polymer spaghetti in these particles, and this allows for very high ion loading of the particle. And this, the diameter is somewhat pH dependent and also varies with hydration. So this is a little bit problematic, but nevertheless we're able to, using various light scattering techniques, measure different particle sizes. This is basically the essential components of the mesh, if you like, and how it's put together. This has to be dialyzed for a month to remove unreactive chemicals. So it's not something you can do overnight. And then this leads to an unlabeled mesh particle, sponge-like particle, which is then into which is then precipitated iron oxide to form the magnetite particles that we are interested in. These are then centrifuged, redispersed, and separated by magnetic separation. So we were able to synthesize many different sizes. So ferrocarbotran is also known as, commercially known as Reservis, and this has a diameter of about 30 nanometers, and this is its percent of weight of iron oxide. And we were able to synthesize from 100 nanometers up to 750 nanometers, and also compare this with Banks particles of two different sizes and look at their different iron loadings. We did, and the one we ended up being very interested in was this particle, 600 nanometers, which is not hardly a nanoparticle, it's really more of a semi-nanoparticle, which doesn't have a particularly high iron oxide loading per particle, but it turns out it's overcome because in the cells we were studying, the particle loading is very high. So this is what they look like under transmission electron microscopy, which is kind of artificial because these are dehydrated, whereas for ferrocarbotran it doesn't matter, these are dextrose coated. But for these particles it does matter because the diameter changes with hydration. Anyway, are these superparamagnetic? Well, on a hysteresis curve it kind of looks like they are, but if you look very, very closely you can see that in fact the two crossover points do not meet in the middle, so technically they're not quite superparamagnetic, they're really technically magnetic particles, but they're almost superparamagnetic, shall we say. This has some importance when we start to look at the relative size of particles relative to their relaxation performance on MRI. R2 and R2 star are measures of the relaxation efficiency of these particles. Pardon me. When we are doing the imaging of this type, looking for these particles, we're interested in R2 star. R2 star is the T2 star relaxation, if you like. And what we find is that there is something called the static dephasing regime. The static dephasing regime is a mathematical regime beyond which there is no improvement in relaxation. So you can see this is a flat line, essentially the maximal relaxation possible. And what you find is that we reach that particle size at roughly 300 to 400 nanometers. Okay, below that size, we're in what's called the motion averaging regime, where the motion of the particles themselves actually leads to a reduction in their relaxation. So we're interested actually in particles that are in this region, and so the particle of 600 nanometers it would appear for T2 star imaging a very good size. This is just a phantom that we constructed to show different concentrations of cells that have been labeled. We use a standard clinical MRI scanner. No, you don't need a 3T or 7T machine, a 1.5T machine is fine. We use the standard clinical wrist coil, and these are images showing that we could detect down to approximately 1,000 cells relatively easily on a gradient echo scan, which is a standard clinical scan that we use every day in patients. Of course, theoretically, we could actually see fewer than these, down to 100 cells, but in real life, we would not be able to detect anything that small. Cell labeling, we used human fetal mesenchymal stem cells. So in our case, we also looked at endothelial progenitor cells. So in our case, we were lucky in that we had working with a team that had access to human embryonic tissues. And so we were the first group to describe magnetic labeling of human embryonic stem cells. There had not been any group previously working in this area. So these were simply incubated. We had all sorts of fancy plans to try and do various kinds of labeling, but we found a simple incubation worked just fine. These cells were washed with PBS, centrifuged, and these are Prussian blue labeled images on light microscopy showing intracellular ion labeling, and on electron microscopy showing that these particles are contained within endosomes and in fact clustered in this way. And this is very similar to what has been described with other particles in other cells. These endosomic clusters are actually very important from a magnetic performance point of view because they make multiple particles look like one particle. for the purposes of the MR. And so there's an aggregation effect, and it also sequesters the particles from water, which further increases their detectability on MRI for various